Should be packed.
Wait, what up? I ain't ready. I get ready. Ready? Yeah. Your throat. You got that throat big. You got a big ass throat. That's what it is. Your throat big. I can't.
Okay, guys. This is my room. So my surgery was supposed to be June 4th. I went to do my labs and my chest x-ray. I did everything yesterday, June 2nd. And I went to Cipla, and Urina, who's Disla's assistant, told me that my surgery is going to be moved till Monday. And that I basically had to wait for my lab results to come back because June 3rd is a holiday. It's Corpus Christi and Santo Domingo. So, yeah, I mean, nothing I can do but hope for the best. And if it happens, it happens. If not, of course, I'll be. Okay, so after all the riffraff that I had to go through, I'm finally about to get ready to go back for surgery. I'm super, super nervous. Oh my God. But I asked for this. I'm here to this day. Hey girl, are you back?
No, I gotta go back downstairs.
I'm out here recording for my YouTube. Say hi. This is my YouTube.
Hi. I'm going to relax again.
Hi guys, I've been trying to prolong this video as long as I possibly could, but I know like everybody has so many questions about surgery, my surgery in general, whatever. So I'm just gonna go ahead and make the video. I was really trying to wait a good 2-3 months because if you had surgery before, you know that it's a process. It's not just a week process or a month. Like it, some people, they get infections 3 months later or a month later. You never know. So and I was planning to give you guys the real tea on my experience. But overall, so I went to Disla, and overall I like Disla. She's very nice. She's just, or was that week, I don't know what's going on right now because I'm not there, but the week that I went, it was super crazy. It was a holiday. I went on a Monday for my surgery to be on a Friday, but that Thursday it was a holiday, so a lot of her surgeries were being moved. So my surgery went from being on that Friday to being on Monday. So I had all this time there. I was there for a whole week before I even got a chance to get surgery. So I was super bored. I was ready to come home. I was thinking about like I was like, maybe I just shouldn't do it, like, because I was already scared. Just for personal reasons. I just felt like, I don't know, like, I'm just very superstitious, but anyway, for personal reasons. But everything turned out, fine. Everybody wants to know about the pain level. So I had a breast lift. I didn't end up getting implants. I wanted implants. Disla was like, you don't need implants. I was like, but I want implants. She was like, okay, well, if you want me to put implants, I'll put implants. I'm like, wait. If you don't think I need implants, then I don't want implants. She's like, no, it's whatever you want. And I'm like, well, you're the surgeon. I came to you because I trust you. And if you don't think that I need implants, just don't give me the implants. It's fine. Like, if you know that you can give me, I wanted nice, round, full boobs. I just didn't want them lifted. I wanted them to be like I had an implant. Like, and she was like, let me ask you one question. Do you want big boobs? And I was like, no, I have big boobs. I want big boobs gone. And she was like, well, okay then. You don't need implants. That's all I need to know. And I was like, okay. So she marked me up. I didn't have my butt done because my butt was already super big from my first round. She was just like, I'm just going to touch you up because I had like little dents, like cellulite maybe, I don't know. She didn't really name them. She just like, yeah, little dents, which I knew that I did have. Like, I would rub my butt and I would feel dents in my butt. And she's like, so I'm not going to really touch your butt. You just need me to fill it in and you'll be fine. I'm like, okay, cool. I was like, but I want hips. Like, I wasn't being bossy like this, but I was I was just telling her what I wanted because she already knew. Like, let me rewind that. Like, when she walked in the room, she looked at me. She already knew what sis needed. She knew that I didn't need implants, that I just needed them lifted. She already knew that I needed hips. She was like, okay, you got a hip on this side. Like, before I even told her that I needed a hip, she was like, okay, you got a hip on this side. I'm just going to add some over here. Like, she was marking me up and just telling me. I'm like moving with her. She like, don't move with me, be still. So I'm like, okay. Like, thinking in my head, like, she's a boss bitch. She know what she's doing. Like, let me quiet. So she marking me up. So my left hip, she's like, you have a hip on this side, but it was super low. I had hip dips. And I'm like, yeah. Like, when she's telling me this, I'm like, yes, that's what I got. Yes, that's it. Like, And it made me super happy, super confident, super comfortable, like, who I chose, because everything that I did not like, she was naming it. And I'm like, that nobody else would notice, though. Everybody was like, you don't need surgery. You're good. Don't do this. Don't do that. Which, I'm the type of person, I'm going to do what I want to do for me anyways. Like, the first time I had surgery, like, nobody even knew that I was having surgery but my best friend. And he only knew because I talked to him about it every day. Like, I talked to him about everything. My mama didn't know until I was leaving 3 days before. My mama didn't know. But this time around, I was telling my friends, my family, like, hey, I'm going to get surgery. Like, because I was mentally stronger about it, and I really just didn't care what people thought. Like, the first time I was like, I don't want nobody trying to talk me out of it. I had a man. He was trying to talk me out of it. I was like, you know what? Is you hating on me? Is you hating on me right now? Because I'm getting surgery. Like, but yeah, what was I saying? So she already knew, like, everything I needed. I was like, nobody noticed this but you. Like, this is what I'm thinking in my head, though. I didn't say it to her. Because my stomach was already super flat. So she, like, marked up a little bit, like, where she was going to lipo, because, sis wanted it lipo. But her assistant was like, stomach is on flat. Before I even had got surgery, I'm like, I know, but we gonna do some more. So yeah, so she marked me up. I'm like, yo, this is crazy. Like, I didn't even have to tell her nothing. I felt like a little remedial afterwards, because after she already had said everything, I was like, yeah, because I want hips. I want to be shaped like this. Like, I want like that. Like, I had to emphasize that. She had to know. Like, and she's like, Like, sis, I know. I got you. So after she marked me up, I sat and I waited. This was like at 7 a.m. I did not have surgery until they came and gave me the blue pill at about 6:55 p.m. They had me there at 6 a.m. I was there at 5:30 a.m. I had my driver. My driver picked me up at 5 a.m. to take me to Cipla. I was not missing my out. I was gonna be first. I was gonna be the first patient. I was there on time. I was the first one there. The doors wasn't even open. My driver was like, "Ma'am," I'm like, "Don't leave me, please. Like, I'm scared." So he sat out there and waited for me for a little bit because the security guard wasn't opening the door and let me in. So I had to wait, which was cool because other patients who were going to Disla, they started pulling up too, and they're like, we all so ghetto, we all so ready for surgery. She's pulled up, she hopped out her Uber. She said, I left my driver was late. She hopped out her Uber. She was like, sis, is Cipla not open today? Like, what's good? We need our surgery today. I'm like, they ain't open the doors yet, we good. So she's like, Disla told you to be here at this time too? I'm like, yeah. So it was like 5 of us. Like, yeah, she did a lot of girls that day. And unfortunately I ended up being the last one, but it is what it is. So they came and gave me that blue pill at about 6:55 p.m. And they rolled me back for surgery. I woke up in recovery. I woke up in recovery, and when I woke up, no lie, I was like holding myself, like my babies are gone. They're gone. Like, and I wanted them gone so bad, but I still was like gripping them. I don't know. It was a sensitive moment, but I'm happy that they're gone because they were giving me troubles. But yeah, so I woke up in recovery at about 12:15 midnight. So I got my blue pill at about 6:55 p.m. I looked at my phone when I took the pill. They came and got me probably 5 minutes later in a wheelchair, pushed me back, whatever. I had a nurse there. What was my nurse name? Oh my God, she was so nice, and I forgot her name. I'll add her name right there. I'll put her name. But yeah, she was super nice. I had her for 24 hours, and I think it was like $100 for 24 hours, and like 75 if you only want it for 12 hours, something like that. Yeah. But so they came in, they pushed me back, went into surgery. I woke up in recovery. Oh my God, I was freezing. So my heated blanket, it came in to play immediately. It executed the plan. Like, I was looking around, everybody was shivering. We were all like this. And as the medicine was wearing off, I'm such a goofball. Like, I'm laying in the bed and I'm like, looking at my hands like, what is wrong with me right now? I'm like trying to move my legs. I'm moving my legs, and I'm just doing too much. I just should have took my butt to sleep, but I'm like nosy. I need to know what's going on with me at all times. I'm like, okay, is this normal? Like, so because I don't remember. I just remember being super cold. I just remember doing all the tremors or whatever last time. But I just remember being super cold. But my heated blanket, I was like, hey, can you go and get my nurse, please? And they went and got my nurse, and I'm not asking her. And I'm like, hey, can you please bring me my heated blanket and put it on me? I'm freezing. So I just so happened to be by the wall where it was a plug, thank God. So she plugged my heated blanket up, and it was amazing. So I had to sit there for a little while, and they said until the medicine wore off. I had a roommate at Cipla because we both went to Disla. It was cool. She had her own nurse. I had my own nurse. I stayed there all night. In the morning, you are going to need a nurse. Like, if you think that you are going to have surgery and you're just going to be in this hospital with a call button and they're going to cater to you, sis, no. It don't even matter if you're taking a friend, cousin, or foe, because I don't think that they can be there. I'm not sure, but I have never seen a girl with her sister at Cipla in the the hospital room. I could be wrong. I've just never seen it, so I don't know. If you've ever done that, maybe you could drop a comment below and help somebody else out, but I have never seen that. Yeah, but you're gonna need your nerves, because you, especially, you can't be lifting, you can't be moving, whatever. So I went back to my recovery. I was running on a Disla. They was like, "Do you need a wheelchair?" They was taking too long to bring my wheelchair, and my driver was outside, and I was ready to go. And they was like, "Give me your bag. You can't be carrying your bag. You just had your boobs done." And every time one of the nurses at Disla would mention my boobs, I was shimmying. I was just happy that I had my boobs. I was just so happy. I was like, yes, this day has finally arrived. Like, I put it off for so long. I'm just so happy. So yeah, so they was like, "You don't need to be walking, you are a strong girl." I was like, thinking in my head, like, man, I have been the worst. Like, I just want to go home. So I got to recovery house. Everybody wants to know, how long did I stay after surgery? I'm a bad girl. Don't listen to me. Don't follow me, please. I only stayed a week after surgery, which I would not have done if my surgery was not moved, but it was moved and I was not changing nothing, unless my doctor was going to keep my draining, or any infection or any illness would have came, I would have stayed. I told myself the day before it's time for my flight, if I'm not feeling confident enough about leaving, if they don't take my drain out, because I left the following Monday, they took my drain out that Friday. I was like, they don't take my drain out on Friday. If I get any infections, if my incisions are opening, whatever, if anything out of the ordinary happens, I'm going to change my flight, because I had that option, and I'm just going to stay at the recovery house longer. Nothing happened. I did my COVID test. The COVID test was $50. My recovery house, DR, Better Self, is where I stayed. They arranged my COVID test for me to be COVID tested. They arranged that for me. I didn't have to worry about that. The guy came out to the house. He was super fine. Super fine. He came out to the house. He did the COVID test, and Lord, he was up here. I know he was up here. There was a little blood on it and everything. Oh, I just don't do good with COVID tests. Yeah. So he did my COVID test. It was like $50, and then he left. Whatever. I was like, okay, I'm going home. But I was like, thank God I don't got COVID. They send you the results in your email, because you're gonna need it to fly. You have to have that to fly. They ask for it when you check in. Your bags, they ask for it, so you're gonna need that. You have to pull it up on your cell phone. What else? So yeah, I only stayed 7 days after, but like I said, do not follow me. My intentions was to stay at least 10 days after surgery, but they moved me, and I was like, I'm not moving nothing else. I want to go home. I miss my family. I want to go home. So, yeah. So I got home, and I don't know, I just felt so much better, because you can't shower. You literally have to wash up with bottled water. Because before surgery you can shower, but after surgery, no, because the water is a little funky and you have open incisions. You don't want to take a shower. Like, you use bottled water. They give you like a bed bath. Like, you are in the bathroom getting a bed bath. Like, I mean, you feel amazing after it. I mean, soap and water to the tush always feel good, right? So yeah, so that was that. I came home and I just felt so much better. Overall, like I said, I really liked Disla. I really like her work. I'm really happy with my results. I have on my faja right now. I had bought 2 fajas. I am not in my stage 2. I'm just on the last hook. I'm not rushing to compress more. My fluid is all gone. Massages, I had 6 massages. I had got a massage every day that I was there. The massages you are going to need. Don't think like, oh, I don't need a massage. You need those massages. And I recommend that you do as many massages that you can while you're in the DR. Unless you know somebody in your city who actually, you need to ask them, like, do you do lymphatic drainage massages? And if they say yes, say, is it the one where you literally drain me. You're gonna get the fluid out of me. Not just move the fluid around. You need to get that fluid out of you. Because I've heard of girls, they accumulate like a cyst or a boil or just some type of infection in that area where the fluid is just sitting. Because it has to come out. Like I believe it has to come out. Like I've seen a lot of people get infections from it. That's not really it. My recovery house, it was nice. Would I recommend them? I would recommend them. They were okay. I did not like the food. I was over the food real quick. I was ordering Uber Eats like every other day because I just didn't like the food in little portions. I'm a big girl. I like to eat, and they were giving me portions that even my 1-year-old nephews could eat. Like they wouldn't even be full of that. So, but yeah, overall, it was nice. Nobody stole anything. I did have a private room. I will post the video so you guys can see. I did make a video of that, and I will tag their name, their Instagram name. What else is there? How much money should you take? People is asking. So I think that to be safe, I don't know what you were quoted or who you're going to, but to be on the safe side, I would say I would take at least $10,000 because you never know. You never know what might happen. Blood transfusions, if your doctor don't include the meds with the procedure, you're going to need to buy your meds, or you can bring them from your doctor in the States. I got mines from my doctor in the States. That's just what I chose to do because I don't know what it is they're prescribing. I have actually heard that surgeons have prescribed girls antibiotics over there, and it would be something for pink eye. So that could be a lot of reasons why girls get infections. But I was like, I'll just bring my own antibiotics. I'm gonna bring my own pain meds. I'm gonna bring my own heparin shots. I got this. Like, I want my own booby cream. I got everything. They kept trying to give me at my recovery house. They're like, hey, you gotta go and get. I'm like, I got everything. All right, can we see? I'm like, no, you don't need to see what I got. I got it. Like I'm gonna take my meds on time. Like, I don't need you to take my meds, put them in your closet, and disperse them to me like I'm at the nursing home. I am good. I'm gonna keep them right here locked up in my suitcase, and I'm gonna take them when it's needed, like when it's time. I got this. I'm very well. I'm competent enough to take it. Like, I got this. So, yeah, that's everything. Driver is probably ranging from like 150, and they take you everywhere. I think that's it. Yeah, that's it. Overall, would I recommend Disla? Yeah. I would recommend Disla. I'm just gonna say this, and this goes for any surgeon in the DR. You have to be mentally prepared. Both times I went for surgery, I went by myself because it's really a mental thing. It is really a mental thing. I'm sorry, guys. Having surgery, like, you don't need to take nobody that's a negative Nancy, because you might get there and your hemo might be too low, and then you don't need nobody bickering in your ear. You need to regroup and figure out what you're gonna do. Figure out if it's fixable while you're there. If it's not, you don't need nobody else chiming in, saying this and that. While you in surgery and you come out of surgery, you're gonna be in hella pain. You don't need nobody just, you're gonna be like, that might be a fallout. You don't need that. I'll call you. You could be support over the phone, because then if you ain't got the kind of support that I need, I can hang up. I don't need you right here. But it's nice to have somebody on standby that know you're going there, that has a passport, so if they need to come to your rescue, they can come. You know what I mean? But other than that, like, go by yourself. You'll be fine. Like, it's translators everywhere. You know what I mean? But if you have that person that is super supportive, you don't got to worry about none of that type of stuff, take them. You know what I mean? Like, it's nothing for them to do, though. Like how my surgery got pushed back, I was like, oh, I didn't even tell you guys. So I did not end up staying in the Airbnb. My cousin, she went still, but we did not go together. Her date, she had her thing going on that worked for her, which is fine. And then my friend, she couldn't get her passport at the last minute, so I ended up switching from canceling my Airbnb and going to the recovery house. So that's what I forgot that I did. I didn't update you guys on that. So that was what happened with that. But everything worked out. Everything's good. But yeah, like if you have that person, cool. If you have a surgery buddy, cool. But you know, it's surgery. It's like you have to be very mentally strong. You have to be mentally strong in order to go into surgery. Like, yes, physically, yes, of course, but everything starts here. Like, if it ain't there, like, you need to be able to make the right decisions. Don't be making bad choices, you know, but that's a whole nother topic. But yeah, my hemo was a 14.5. I did Geritol with vitamin C. Every time I took a shot of my Geritol, I drank a glass of Simply orange juice. I took iron pills. I drank so much beet juice and spinach smoothies, so I couldn't do it no more. Once I landed, I got to the recovery house. I said, y'all got beet juice? Y'all got beet juice. She was like, yes, I got beet juice. It was horrible. It was very gritty, but I believe that was what put the icing on the cake, because I was a 14.5 after flying and everything. Everybody wanted to know my stats. I am 5'3", and I weighed 176, which put my BMI at like a 31. I think it was a 31, so I was good. So yeah, I mean, if you have any questions, you can add me on Instagram. It's Jasmine Christina _, maybe. I'll drop that too. Or you can feel free to message me on here, comment below. Make sure you like, comment, subscribe, share with your surgery buddies. Anybody who you know is going to get surgery, send them my way. I don't mind giving advice, because it really is a hard time. It really is, you know, like overwhelming. But yeah, so make sure you hit that bell. Thanks for watching, guys.